What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
And welcome back. Over the past several weeks, Hoag Medical Group has been bringing us some great doctors with some fantastic and very useful information. Today is no exception. We have Dr. Hima Natla on, and you are a diplomat of the American Board of Internal Medicine. Welcome.
Thank you.
Nice to have you on. And you just told me right before we started here, you've been with Hoag for not too long, a few months?
6 months.
And do you work out of one of their particular areas?
Right, Irvine.
Irvine, okay. And today we wanted to talk about osteoporosis, and that is something that certainly affects the age group of this community.
Right.
And I think we've all had family members that have had it to some form of another. I know my mom was alive, she had it. She smoked for years and years and years, a leading cause of it. So what exactly is osteoporosis? How does it affect someone, and how does it come on? Does it take months, years?
So osteoporosis is like a weakened bone, like a brittle bone. We usually see osteoporosis in women older than 65 and men older than 70. But nowadays what's happening, because people having a lot of comorbidities like so many diseases, and they're being on several medications. So people are having osteoporosis even earlier age, so even in 50s. So it's really important to get screened at earlier age. In the past, they used to think it's a woman disease, old women, just hip fracture. So it's not just a woman disease. Even men are getting the osteoporosis. So it's disease of everyone.
Yeah, that's interesting you say that, because I always thought it affected women and not really much to men, but it seems like it does. You mentioned that there are certain causes. Obviously, we've always heard about smoking as one of the major causes in that, but you mentioned medications. So there are certain medications that can bring on osteoporosis.
Sure. So per se, like hyperthyroidism patients, like thyroid, they've been on thyroid medications and cancer medications, and also transplant medications and antidepressants, seizure medications. There are like so many medications, like steroids. A lot of people use steroids for asthma, rheumatoid arthritis. Long-term use of all those medications cause a faster bone loss. So you see osteoporosis at younger age.
What are some of the warning signs, and do they manifest themselves early, or is it come on when someone maybe has a bruising? They might have hit their wrist against something and they have unusual bruising or unusual pain for something so it should be minor.
So interestingly, osteoporosis is a silent disease. So you don't have any warning signs until you lose a lot of your bone mass. Your bone is already brittle. So it's important as soon as you started seeing some back pain, chronic back pain, and you're like in your 60s, and we measure height when the older people come, everybody. So we see short. Slowly their height is getting shorter, like 0.5 centimeters per year. So that's a warning sign. They're getting shorter. They're like having chronic bony pains, and also stooped posture. They get shorter and shorter. They get stooped posture. That's also a warning sign. And any trauma, like even minor trauma, you get fractured bones. That's a warning sign. Yes.
Would because they're losing bone mass, would their weight go down? Would that be a warning sign? If in other words, you look at them, they just seem overall to get tinier, to get thinner.
No. Because losing bone mass doesn't affect the weight of the person, because it's just a density we lose.
Okay.
It's just, it get porous. It's very weak. When you look at the pictures, you don't see the solid mass in the bone.
Yeah, it almost looks like
Like
Swiss cheese or something,
yeah.
right? And how, you mentioned obviously the medications, what some people just have to be on, and of course smoking. I think even the eye doctors we just had on talked about how smoking affects
Right.
macular degeneration and just about every disease out
Right.
there. So that is something you can control. We've heard over the years, increase your calcium level.
Right.
Is that true?
That's true, exactly. So the lifestyle changes is very important. So it's not too late for bone health. So lifestyle change, like start exercise, eat high calcium diet, high vitamin D diet, get more sun, and get more vitamin D. It's really important. So eating more enriched diet of calcium and vitamin D, exercising regularly, avoiding smoking, avoiding alcohol, and also because a lot of factors are uncontrollable, like being woman and hereditary. It's hereditary. If somebody family members has it, you're definitely gonna have it. You get it sooner or later. So based on all these things, we need to take more precautions, like eat right, stay healthy, get screened early. Go and talk to your doctor. If you're in your 50s, you have to get screened.
So that's a common thing for women to get
Yeah,
screened. It's
yeah.
simple X-ray. Is that what you do?
Yeah,
or-
it's called
okay.
DEXA scan. So basically, we scan them based on their risk factors.
Okay.
So usually we scan when they're women older than 65 and men older than 70. That's a common criteria we use. But nowadays, as I said, a lot of people on multiple medications and they have so many comorbidities. When the patients comes, we ask all this questionnaire, and based on their risk factors, we start screening them. It's a DEXA scan. So basically, it's an X-ray, very low radiation, no risk of too much radiation exposure, and it's basically test the bone density in hip, wrist, and spine. Those are the most commonly affected bones. So once we get the bone scan, we categorize the severity based on T-score. So T-score means it's just a numbers. Lower the number, the severe you have the disease.
Okay. And if someone has this, depending on their numbers, how is it treated?
So treatment, there are a lot of treatments are available. Okay, first and foremost thing I emphasize is lifestyle change and eat right. That counts. So even you're in your 60s, you're diagnosed with osteoporosis, change your lifestyle, start exercising, eat more high calcium, and talk to your doctor if you need calcium supplements and vitamin D, because sometimes older adults, they can't eat too much cheese and milk because of lactose intolerance, and sometimes they can get vitamin D from sunlight because of their homebound status, some cold countries, cold states. So you need to take supplements at that time. And also based on the severity, we start on medications like biphosphonates, and also hormones are available, estrogen for women, but we rarely use estrogens, and some biological antibodies. There are a lot of treatments available to stop the disease and prevent to stop the progression of disease. And most of the treatments help to build this little bit of bone, but none of them right now cannot reverse the disease. So prevention is always better than treatment.
Okay, so at least it's something that if you do have this, it's a disease that you can maintain it, and maybe not reverse it, but help it not get worse.
Yeah, we sometimes it's not in our hands. If they're really susceptible, they have so many risk factors, it's really hard to even stop the progression. But during this type of patients, we closely monitor them, get every year DEXA scan. We have to work with each patient. It's individualized treatment plan for those type of patients. But in most of the cases, we can at least stop the progression.
All right, very good information. And if you'd like to get a hold of Dr. Natla, you can call Hoag, and their number is 949-791-3101, or go online to hoagmedicalgroup.com, and just whoever you talk to, tell her you saw Dr. Notland here on Channel 6, and you'd like to talk to her, maybe you have osteoporosis or you'd like to be screened for that, and she can certainly help you out. Nice to have you on. Good information.
Thank you. Thank you for giving this opportunity.
Sure. All right. Thanks you.
Thank you.
We'll be back in just a moment, and Marcia is here with an intern.
What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.